I'm Dr.Shagun Sabarwal, and I am the South Asia and Monitoring, Learning and Evaluation Director for WomenLift Health. So the unique aspect about women in health is that healthcare per se is dominated by women. So 75% of the workforce in health globally are women. And yet when we look at the leadership positions, we find that it's only 25% of women who are occupying leadership positions, senior leadership positions. They are board members or they are chairs of important committees. So one of the things that we found through a study that recently got published in the Lancet Southeast Asia issue is that there are three main barriers that women leaders face. Women who are mid-career, which means that they have been working for 10 to 20 years in health, they have the expertise, they have the talent. And the three main barriers are, number one is harmonizing work-life responsibility, which means that women often face a lot of issues in trying to balance both the work as well as their work responsibilities. The second issue that has come out is the violence and the harassment that women face in typically male-centric environments. So as we all know that in India there is a lot of patriarchy, there are a lot of gender norms that decide and define what women can do and cannot do, and all of these things also occur in workplaces and hamper women's own growth. And then the number one, another important barrier that has come is the lack of mentorship. So women are not able to access mentors and role models, and that also comes in the way of their being able to learn and grow. So I think when it comes to health, especially healthcare delivery, we all see and encounter a lot of women who are a part of the workforce. So whether you're talking about community health workers like your ASHAs or ANMs, or you're talking about nurses, or you're talking about doctors, or you're even talking about researchers, we do find that women are there. But again, when you start to look at senior leadership positions, you see that there it's not translating. So it's like a pyramid. You have a lot of women working at different levels, but when it comes to the top of the pyramid, the number starts to fall steeply. And that is a cause of concern, because having women's lived experiences on the table along with men leaders can make a big difference in the types of policies we are designing, in the type of schemes we are designing, in the type of solutions we are coming up with. So I do think that it's not a problem that we're not having enough women in health per se. The problem is that these talented women are not reaching where they should. So I think at WomenLift Health, we are increasingly recognizing that sexual harassment is such an important problem. And in a country like India, where one of the laws that India has around POSH, around ICC is quite egalitarian and is quite deep, the law. And yet when it comes to the implementation of the law, I know that there are still a lot of gaps. So at WomenLift Health, we do believe that when we're looking at leadership, it is very important that the leaders themselves are equipped with the right tools and the frameworks so that they can deal with the sexual harassment that may be occurring for their team members and can take a much more proactive role. So I think when it comes to mentorship, a lot of times, it is like a universally acknowledged thing that having good mentors, having good supervisors make a difference. And yet we are not doing much to enable that to happen. Mentors are not born. It's not that you wake up one day and you're a great mentor. There is an art and science behind mentorship. And I think this is really a low-hanging fruit where institutions can do a lot to invest in building the capacity of future mentors, in providing training courses and having conversations around what would good mentorship look like and how can I become a good mentor. And then also investing in programs where you can link up mentors and mentees. It should not be assumed that your supervisor will automatically become mentors. In fact, there are a lot of stories and examples where informal mentoring has really helped both women and men grow. So I think when it comes to affirmative actions, when it comes to quotas, I think those are extremely important, and especially in the Indian setting, we have seen that there's a whole history of this affirmative action. But I would say that just having affirmative action is not enough. It is in fact the first step to enable the representation. But after that, there's a lot that has to be done to make sure that these underrepresented communities or underrepresented minorities are also having an enabling environment that is allowing them to grow and thrive in whatever roles they are. So yes, affirmative action is important, but that's not the end of the story. In fact, that's the beginning.